Thank you, Madam Chair.
The only pharmacist in the Congress. How's that?
That's great. Thank you, Madam Chair. I appreciate it. And I appreciate all of you being here. This is certainly something that's very important to obviously to all of us. Ms. Avila, I wanted to ask you, it's my understanding that Puerto Rico's largest benefit categories in terms of spending is outpatient prescription drugs. And that the amount spent on drugs is projected to be over $800 million in FY 2020. Why is that?
Well, that's why, because we work with a rebate program in Puerto Rico. But the rebates are coming to the government directly, doesn't goes to the MCOs or the managed care organizations. So it is artificially priced, the drugs.
I get that, but what I'm getting at is in comparison to the national average, it's much higher. That same program is applied all throughout the country. So you're right, 800 million is somewhat skewed, but at the same time, in comparison to the other numbers with the rest of the country, it's above the national average, and I'm just wondering if there's a reason for that.
Well, I will need to look for more information because our pharmacy program is mandatory generic, bioequivalent mandatory, right. And we have more than 85% of those includes in our utilization. So the prices, the drug prices has been increasing in 20%.
I get all that. And again, where I'm coming from is just in comparison. I'm comparing you to the rest of the country, and in comparison, the percentage spent on prescription drugs is higher than it is elsewhere. I'm just wondering why. And also, a lot of indicators are telling us that the outcomes are worsening.
Well, we have a lot of diabetics, hypertension. We have some outliers in our population of those conditions that drive the cost to those extremes that we are looking. But we already have programs in place that monitor the utilization, but the behavioral of the population, we haven't had all the programs in place to be able to track, to go and look for those programs that monitor the clinical aspect of our population. But it's a reality. Yes, we have sicker people in.
Well, please understand, I'm not coming from a critical perspective.
No, I understand.
I'm inquisitive as to, and you've just answered some of my next question. That is, what kind of health problems are you having? I mean, I'm from the South. In the South, we're the cardio belt. I mean, we have a lot of cardiovascular disease because of diet or whatever, but that's a big problem we have. Now, you've just indicated that diabetes, hypertension. Do you have any kind of wellness programs in place that you're trying to push forward?
Yes, since November 2018, we implemented a new healthcare model in Puerto Rico, and we are looking for high utilizers programs that works with the social determinants of our population, and they need to bring new programs to our healthcare model. We are monitoring those changes as we speak. Since November 2018, we are in our first 6 months of that new implementation, and we're supposed to be gathering better outcomes, because that's why it was one of the main intentions of that change.
Okay, let me move to Ms. Sablon and Ms. Young. Your two territories, as I understand it, and please forgive me if I'm being redundant in my questions. I've had another committee hearing going on at the same time, but it's my understanding that you have a waiver, that your Medicaid and your CHIP programs are under a Section 1902J waiver. Are you familiar with that?
Yes.
Ms. Young, you are?
Yes.
And that waiver is specific, as I understand it, to just your country and Ms. Sablon's country. And I was just wondering, do you feel like that waiver might help some of the other territories? Is that something that has benefited your countries?
Well, our 1902J waiver...
territories, excuse me, I'm sorry.
Yes, it has definitely been to our advantage because we're so unique in so many different ways. We don't do individual enrollment. We're very remote, and we also only have one airline that has 2 flights a week to our territory. So it limits our ability to do a lot of things. But I think as to the other territories, I think it'd be best for them.
Right,
But I have heard that people are interested in our 1902J waiver.
right. Ms. LeBlanc?
Yes, that is a very unique program. And so what happened is like we drop off the categorical requirement and it's applied to anybody that meets our income and resource limit. But we are doing eligibility
Good, good.
enrollment.
Well, thank you all for your efforts in making these programs the best that they can be, and we certainly stand ready to help you in any way that we can. So thank you, and I yield back.